Good afternoon, everyone. My name is Mike Spicer, and I'm the President and CEO of St. Joseph's Medical Center, and I thank you for coming today. A special thanks to Mayor Mike Spano and Senate Majority Leader Andrea Stewart-Cousins, County Legislators Jose Alvarado and Chris Johnson, as well as members of the Yonkers City Council, for taking time out of their busy schedule to join us today to celebrate the grand opening of our newly redesigned and beautifully renovated St. Joseph's Thomas and Agnes Carvel Foundation Family Health Center. The Family Health Center provides high-quality primary and preventive care to individuals of all ages. Led by our board-certified physicians, the Family Health Center also serves as the main teaching venue for our family medicine residency program, training future healthcare leaders. This building, established in the early 1990s, currently provides care to almost 9,000 patients whose visits exceed over 25,000 annually. Needless to say, more than 25 years later, it was time to renovate to meet the continuing growing healthcare needs of this community. The renovations include ample space and lighting for patient and family-friendly care, new expanded lab services, fast-track nurse triage exams for walk-in and sick visits, 24 renovated patient exam rooms, redesigned procedure rooms, dedicated medication room for enhanced patient safety, and a resource room for patient education. We are also excited to announce that we now offer telemedicine so that patients can be seen by our doctors virtually in the comfort of their home. In addition, in conjunction with our partners at Feeding Westchester, we have also opened an on-site food pantry to provide nutritious food to patients that present as food insecure. Simply put, this is a major renovation that allows for improved patient flow and expanded access to care with nutrition while continuing to keep the patient at the center of their care. This project was made possible by funding received through the New York State's Delivery System Reform Incentive Payment Program Capital Restructuring Finance Program. Grants from this program are intended for capital projects that will enhance quality, efficiency, and access to care, and that is exactly what we've done. St. Joseph's continually evolves to meet the needs of our community, and I'd like to thank Mayor Mike Spano for his support for all of our projects. Also, a big thank you to Senator Majority Leader Andrea Stewart-Cousins for her support not only of St. Joseph's, but of all the hospitals throughout the state that continually face many challenges in an ever-changing healthcare system. Special thanks to Jose Alvarado and Chris Johnson for enabling us to expand our telemedicine program through a grant that they secured for us. Thank you. Lastly, I must mention that we at the hospital are not alone. We work with the support of two great groups. Our sponsors, the Sisters of Charity. With us is Sister Donna Dodge, President of the Sisters of Charity, and of course our Board of Trustees. We are grateful for your presence and look forward to providing you with a tour after the ceremony. It is now my pleasure to call on the Chairman of the Board of Trustees at St. Joseph's Medical Center, Mr. Jim Landy.
Madam Majority Leader, County Legislators, and everyone here. I want to thank you for being here today as we celebrate this important milestone in the history of the Family Health Center. This multi-year renovation is truly a testament to our ongoing commitment to providing health and wellness equity to the community of Southwest Yonkers and beyond. This newly renovated center not only allows for improved patient flow and enhanced care, it provides patients with access to the highest quality health care and care coordination in a beautiful setting. New state-of-the-art technology, care, and nutritional services, all here under one roof. I would like to echo what Mike Spicer just said in that I would like to, on behalf of the board, which represents the community, to particularly thank County Legislators Alvarado and Johnson for arranging some of the funding for the expansion of our telemedicine program that will enable us to identify underserved populations in our community and connect them with the quality healthcare services. And most importantly, treat the needs of those individuals who may be homebound or experience transportation or other barriers to accessing care. Because of this generous funding, we will be able to touch more lives than the almost 10,000 people we serve of Yonkers residents in this facility today. You know, St. Joseph's serves over 1 million outpatient visits a year in all of our about 25 centers that are involved in the communities that we serve. They go from the Connecticut line to the Jersey line, all the way through Staten Island. But this is an important, integral piece of it. Mayor, as I said, it's 10,000 people are served in this organization, in this facility. The population of Yonkers is 200,000, so we have 5% of the people in Yonkers being served here. Again, I would also like to acknowledge the presence of my fellow hospital trustees that joined us today. As Mike mentioned, we have the president of the Sisters of Charity, our sponsor, Sister Donna Dodge, sitting in the second row. We have Margaret Cusimano and Sister Margaret Egan, who's also sitting with Sister Donna, and Bill Schneider. Did I miss anybody that's here? We asked for low turnouts so we could be socially distant. Our Board of Trustees provide wonderful leadership to make everything we do possible. Again, I'd like to thank all of you for taking the time to join us today, and I take great pride in St. Joseph's and all that it does. The fine physicians, the residents, the staff here this evening who provide such exceptional care to the members of the communities we serve. It is now my pleasure and honor to introduce the mayor of the city of Yonkers, who has been a great supporter of ours, I think because his father was a longtime trustee of the hospital, but Mayor Mike Spano.
Thank you so much, Mr. Chairman, and it's good to see all of you here, especially our healthcare workers who are on the front lines. I want to say thank you. Thank you for your hard work and for your dedication. You have been the heroes of the last couple of years, and we very much appreciate that. We certainly appreciate what's happening here today. You know, one thing that COVID-19 did bring out is the disparities between healthcare when it comes to those who have and those who have not. And one thing that we know for certain right here in Yonkers, that the health and the vitality of St. Joe's is critically important to the people of this community. And so that's why this expansion is so needed here. Even the whole idea of, I guess, Zoom with a doctor is the next thing we're going to all be seeing. And that's a good thing, because if people are seeing a doctor and they're getting their medical health needs taken care of, then obviously it leads to a better quality of life. And so I wanted to say thank you to all of you. Let's say especially to St. Joe's, to Mike Spicer, to the Board of Trustees. Sisters, it's always good to see all of you. It is, you know that we have your back, and we'll continue to be there and be supportive as best we can, be your cheerleaders when we need to, and offer the support when we can. I have here a proclamation. I know that Mike Spicer has a few of them, so I'll give him another one. And this is obviously on the recognition for the new medical center at the Family Health Center Day here in Yonkers. So we want to say congratulations. Thank you all, and very, very quickly, it's always great to see our Senate Majority Leader here, Andrea Stewart-Cousins.
Thank you, Mike. And now it's my honor and pleasure to introduce New York State Senate Majority Leader Andrea Stewart-Cousins.
Thank you so much. It's so good to be here at St. Joe's. Thank you, Mike, for all that you do, and certainly for I won't say your relative, but our chairman of the board. I love to poke fun at him, Anthony Landy. And of course the sisters, thank you for all that you do, and the staff, and all of you who have made sure that through good times and bad times, this facility continues to adjust itself to meet the needs of our community. It is exceptional work, and I'm just so happy to be part of this revitalization, the renovation of this wonderful, wonderful facility. Thank you, Mayor Spano, for always supporting the good work of this hospital in so many places. We were together earlier today talking about education funding. But this is what we do. If we don't have health care, we've kind of figured it out now. Without your health, what's the point? So the fact that every level of government and my county colleagues are here, having funded the telemedicine portion of it, I think each and every one of us understand how critical it is. But even what's more critical is that people have primary care, that they're not using the hospital as their first contact with their physicians, that they're not in an acute state before they come in for services. So what you've done is created, yes, a facility that actually serves in primary care ways 10,000 of our residents. Of course, they can use the hospital, but they're here getting the preventative care that they need so that they can be healthier and happier and live fulfilling lives. So I want to congratulate you all. I am happy to be not only the majority leader, but I'm your senator. And I guess Mike and this is certificate. It's not as fancy as the mayor's, but the state gave a lot of money, so and this is a certificate of recognition from St. Joseph's Valley.
This is all that was left
This
after
is
all the
all
money we
that
got.
we got. All the money you got. A little paper to make it more happy. Congratulations. Thank you.
And now I'd like to introduce County Legislators Jose Alvarado and Chris Johnson.
Hello, everyone.
Hello.
It's good to be home. I hear day in and day out what happens here, and it is marvelous. And I'm always thinking, how can we continue to reach more people? And my colleague and I got together, and we realized that telemedicine is the future. And we began to piece together something in which we can really reach people. And it doesn't end here. This is a piece of the puzzle. We have some seniors. We have Ms. Kelly Sharella, who leads our Office for the Aging, and she would tell you that even if you want to do telemedicine, some seniors aren't ready to do this type of transaction in their smartphones, even though most of them have a smartphone. So we're partnering with the Yonkers Public Library to do exactly that. Teach them how to connect through their smartphones and so on and so forth. So this is a piece of the puzzle, but it doesn't happen with the community partners that do it day in and day out. And we're always brainstorming in Southwest Yonkers, and I'm surprised that you would agree with this. It's not an area that is gimme, 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 gimme. It's not asking for much. Sometimes we have to bring it to them, but also tap the talent. And I knew where the talent was, So when I called, it was the idea just ran and took a life of its own, and I'm hoping that it becomes something even bigger as we begin to reach even more people through telemedicine. What good is it that we tell people how sick they are if we cannot follow them? So this is the following aspect of things, and I'm so excited. I have to admit that I did get inspired by one of your hardworking doctors here, Dr. Ringstead, who I happen to know personally in the clinic and the good work that she does. But that's how it is. We're a small community and we take care of ourselves. And I'm just happy to be a small part of something bigger. And so is my colleague, with whom we joined this idea.
Absolutely. To the staff, to the sisters, to the board of trustees, to Mike, thank you for the work that you all continue to do day in and day out. There is no, timing is everything, right? And so there would be no greater time to expand services, to say that people should have a facility that they feel comfortable in, where they can go and get the needs and the services that they need, than right now. So thank you for that. And as my colleague at the board said, and I let him go first because even though I told him when he came back to the board that seniority started over, so I'm ahead of him. A comes before J, so I don't know. But as he said, when we had a conversation about how COVID was ravaging our communities and what people needed and how they would access care, the idea just sparked. That we needed to make sure that people had an opportunity to communicate with their healthcare providers when they were home, because that's what we're asking people to do. We're asking people to stay home. We're asking people who, especially those who have been infected, that they quarantine at home and that they stay there. And so how does someone then communicate with their primary care facility if they're home? Well, they have to do it using the technology that we have today. And so it's just been a great opportunity to work together, to brainstorm, to do things like this. And to be honest, as the senator said, this is what government partners do. This is what government's job is, to come together, to find solutions to the problems of the day. And this is a solution. You guys provide solutions each and every day with regard to our health. And this was an opportunity for us to provide a solution to expand that. So thank you for the work that you do, and I'm glad to work with all of my partners in government in making sure that we can expand services. Thank you.
Thank you all. That's the end of our formal presentation. Please don't leave yet. We'd like to give you all a short tour of the back of the house, which is where really all of the action happens, and the ribbon cutting. Thank you for reminding me of that. That's what we're here for. And the staff will be very happy to take you around and show you. So into the back for the ribbon cutting.
Guys, remember, one thing that you don't want to put on hold is your health.
Everybody find like a little spot.
I played Saturday and Sunday, so yesterday was miserable.
Oh, yesterday was awful.
Well, I played. I won $5.
Oh, that's all that matters.
I won the Masters pretty low.
Did you?
So you guys can see, this is a brand new area.
12 guys, and then you add up the
Folks that have been here before would not be able to recognize this. This is totally new, state of the art, beautifully. We have a pantry here that we will show you later on.
Can I get in there and you don't mind, right? If I pose them and stuff? You okay with it? I'm just going to set them up and have them look at us.
Yes, thank you.
Jose, Chris. Okay, Chris and Jose's in the behind. Very good. Good to see you. Don't worry about it.
From the window?
So, is that going to work?
Just a photo op.
We're not gonna cut yet, we're gonna get the photos.
All right, so Andrew, take this
Okay.
turn it to us a little bit. So you shift.
You're gonna have to, I'll just hold steady.
Okay, so
All
we'll
right.
do a couple of shots.
So let's look this way, everybody. We'll just take a few pictures and then Dean, you want to count after? Or whatever.
Take a bunch of shots. Make sure
Right,
everybody got
right
the
here,
photo
right.
first.
Right, thank you. Right at me? Okay.
Over here now for this lady. Take a shot. Take a shot.
She's quick.
Thank you.
Okay.
Okay, I'm gonna do countdown from 4.
5.
4.
Five.
5.
4.
Jeez.
3. 2. 1.
All right.
You're getting good now.
Thanks, Chris.
Pleasure, absolutely. See you.
Right, just give him the tour. Yeah. Yeah, Liz.
So, oh.
Hi, Paul Meissner. You know my
Now we are going for the
Huh?
online.
Oh, okay. Oh, sorry. Hi. So come on this way. Let me start you towards. We'll start in the back and then work our way back to
That
the
makes
front.
sense.
Now we are going for the tour so
now
you guys
this
can
our
see the facilities.
clinical area. We have a medication room where patients, once they need a vaccine or something, they can get taken care of here. What's nice about it is part of the renovations allowed us to create and redesign our procedure room. So the patients that require specialized like GYN services and care can get that taken care of.
Do we
here.
do all the blood work and lab work right on site?
The lab, and I'll show you that in the front.
good, that's
So
good.
I think he's just trying to get by. We can come into here, and again, it's a basic procedure room. It allows the patients to come in, have a procedure done in their community clinic without feeling afraid of having to go into the hospital. And so we can do some basic procedures here that can help take care of anything they might need, and then any kind of continued follow-up. They may need to either come back to us to see the gynecologist or one of the surgeons, and or just follow up with their primary care provider.
Wound care and things like that? or-
Wound care, we can do a little bit here, and then we also do it up at the hospital. The specialty clinic is right next door, so we're able to do some strategic referrals for patients for general surgery, neurology, nephrology. I'm going to take you down this way so get you to the two things that were mentioned in the talk. One is our fast track nurse intake and the expanded lab. So the fast track nurse intake, if a patient comes in with a scheduled appointment, they're following up with their provider, the nurse picks them up, they're registered. It's an easy schedule. If a patient comes in because they're not feeling well, they need some follow-up, What they'll do is they'll register in the front and be seen by a registered nurse for a fast track visit. And that's right in here. And it literally is an exam room that functions fully to the extent that the patient needs it. It allows them to get vaccines, be assessed, make any kind of determination or decisions as to what needs to happen. And to the other part, if they need lab work, right next door.
Yeah. It's a hassle having to go to Quest or some other places to get your lab work. You want to have it all done.
And so again, it's a full service lab. It's big, it's comfortable.
Yeah.
It allows patients to come in and feel,
Go for it.
Again, that they're with their community provider, that they're able to see what's happening. They're able to talk to their doctor. They know the nurses. The families know us. It's generational. We get many new patients every year, but there's a whole host of patients that are multi-generational for us. And as we do care from birth, to 100, those patients, when we talk about our prenatal care program, their ability to bring their babies back to us for pediatric care. I wanted to show you.
Anything for allergies, allergists, or anything?
Allergists, we do work with outside, referrals. And I'm just going to take you into here to show you one of the exam rooms. They're all basically the same. So there's 24 to take the attendance.
You got a lot of kids. One of them is
Right. So two things about these rooms. One is, in this room, you'll notice that this is a barrier-free exam table. So it's lower to the ground. What it allows us to do is for those patients that are either in wheelchairs, the elderly, it's hard for them to step up on a traditional exam table. So we really made it comfortable for them to be able to just sit down instead of having to step up and then sit. So that's one thing that we think is kind of special with all the new renovations in terms of our exam tables, our equipment. So really trying to take it to the next level in terms of the care we provide for them here.
How many? 1, 2, 3.
There's 6. There are 4 pods. Each pod has 6 exam rooms. That gives us 24 exam rooms plus the procedure room, and then the enhanced nurse
Reminds me,
intake.
I got to do my driver's test for my life. But I can't see.
And then once you finish, typically what happens out here is that the patients are seen. Most of those staff are not available right now, but it's the patient care rep, and the patient care rep really provides the follow-up and care coordination. So they coordinate your appointments, any kind of referrals that you may need. They'll follow up with you after the fact. Did you make it to that appointment? Was it successful? Did we get your report back? So really making sure when we talk about one-stop shopping, community of choice. Sure.
Sorry.
That's okay.
No worries.
And what is the pantry? The food pantry?
Oh, sorry.
The food pantry.
Oh, the food pantry. Let me show you the food pantry. My goodness, I completely forgot. Food pantry. So we'll get out of their way so we can take pictures. So we'll stand here for a minute. The food pantry with Feeding Westchester, it's a partnership that we started through the hospital, and what it's going to allow us to do on site is for the patients that we serve, we'll be able to, if they identify as food insecure, needing additional food, they haven't applied for SNAP, they've lost some benefits. If any of those things are present, we're able to offer them a bag of food. Each bag is about 12 pounds. It's non-perishable, so it's all mostly canned goods, but it's got fruit, it's got vegetables, it's got
Great, thank you.
Stay together. Thank you. Yes, you can.
Beautiful.
Thank you.
This is a great facility.
You won't set no alarm. Thank you, sister. Thank you.
It's a great facility.
And so it's really a wonderful thing, the food pantry, which is getting started, the funding that John provided will allow us to enhance the work that we're doing now around health. So it really is improving. A lot of it will go towards the infrastructure for that. So we're really excited about that scope of work that we'll be able to continue to provide and improve. So it's really been a blessing to have the opportunity to be a part of this and here in the community and really making sure that our providers are dedicated, the staff is dedicated, and now the facility is really a beautiful place for them to feel honored to be a part of it.
It's running live. Could you show the food pantry?
Yeah, we can show the door. I'm not opening the door, but we can show the door. Thank you.
Thank you.
Thank you so
Oh,
much.
she's not going to close the room, she's
Yeah,
going
he just has to circle around. There's a sign on it. It's a sign. Oh, I think you saw it. Oh, good. It's a very good thing.
Very nice. Very nice. Excellent. We're smiling? All right. Excellent.
Thank you.